Welcome to the Dear Dyslexic Podcast, where lived experience meets real conversation. We shine a light on the stories that need to be heard, with honest and inspiring conversations with people with dyslexia and other neurodivergent conditions like dyscalculia, dysgraphia, ADHD, and autism. The Dear Dyslexic Podcast is more than just a show. It's a community, a space for connection, and a movement to rethink dyslexia. Subscribe today and join us on our journey, one story at a time. Hello, everybody, and welcome back to the Dear Dyslexic Podcast show. Today, I'm thrilled to have with us Ben Walkenhorst. I think I just said that completely wrong, didn't I, Ben?
You can pronounce it Walkenhurst or
Walkenhorst.
Walkenhorst.
I know we just practiced that before we came on. And Ben is going to be talking to us today around psychosocial hazards in the workplace. Ben's currently got his own consulting company and with BW Communications. And so today we're going to be talking about lots of different things around how to keep workplaces safe psychologically, where we're not feeling vulnerable, where we can be our authentic selves. And Ben has a huge range of experience leading small to very, very, very large teams. And he's come to share with us today his wisdom and his lived experience. So thank you for coming on the show today, Ben.
Thanks, Dr. Shay. It's a pleasure to be here.
Please, I think we've just Shay's fine. Though if my daughter was here, she'd say, why don't people call you Dr. Shay? So we have been working on a separate project around, you've been helping us create some videos around psychosocial hazards in the workplace for neurodivergent people. And I feel like it's a bit of a new term, particularly because it's become regulated in some states and it's now mandated under the Code of Practice for Work Health and Safety. And so I was wondering if you could unpack what these terms even mean to start with before we then say, well, how does this impact us and what strategies help? And before that, even a little bit about yourself.
Sure. Well, let me start there. So my name's Ben Walkenhorst and I'm pleased to be here. I have over 20 years experience, 15 in leadership. I'm a brand, business, product and people builder and a behavioural change marketer. That experience, Shay, has been across government, private and not-for-profit in the finance, retail, tech and education sectors. Largely, I've managed people, as you mentioned, from very small teams of one or two to workforces as large as 200 with direct reports of about 10 to 12. Now, those workforces have been very mixed and varied. People have come from neurodiverse backgrounds, from torture trauma backgrounds, from culturally and linguistically diverse or non-English speaking backgrounds, from being diagnosed or undiagnosed with mental health or physical disabilities. And they have spanned a large age group or generation. We're now working in a workforce which has 5 generations in it. So I've led people as young as 16 and as old as 65 from multidisciplinary and cross-functional backgrounds. And I have dyslexia myself. Might be struggling to get that out, having dyslexia. But I wear these Irlen lenses, otherwise known as rose-coloured glasses, and they filter out a certain light rays that the eyes are allergic to, which helps me to see and helps correct the dyslexia in most cases for me. I'm really pleased to be here today, Shay. Thanks for the opportunity.
Thank you. And I'll come back to that big question I started with my brain racing before really even introducing you properly. But before we really look at unpacking psychosocial hazards in the workplace, tell us a little bit more about your story about growing up. When were you diagnosed with dyslexia? You just said then the glasses really help, but are there other things you struggle with? Because we know dyslexia is more than just our reading on the paper. So could you unpack that a little bit for us?
Yeah, look, I was first diagnosed in about year 5. So I went through early childhood really struggling. My mother and father were really terrific in providing support in the home. But in the 70s and 80s, really the education system didn't understand dyslexia or learning difficulties or a range of disabilities, to be frank. And my parents really understood that, gee, Ben's a smart kid, but why is he struggling academically in the classroom? And after many consultations with educators and facilitators of learning, otherwise known as teachers, they really came up against a lot of resistance. I know Ben's just not trying hard enough. No, he's just not concentrating in class. He's easily distracted. But really, what was going on is I was having trouble hearing where sounds were coming from because my dyslexia has an auditory component to it. I was also having trouble with understanding what I was reading and seeing, and that affected my writing ability as well. So the symptoms for me would be words swimming on the page, fogginess on the page, blurred vision, sounds, not understanding where the sound was coming from with the teacher speaking, and particularly in loud and noisy rooms. So after a number of different things, seeing optometrists, seeing medical doctors, trying alternative medicine practices, back then my mother had heard about Irlen lenses, and that there was a diagnostician. We were 5 hours from Melbourne in a small rural town called Horsham in Western Victoria. So there weren't a lot of services available to us. And this diagnostician, I believe, was travelling from Melbourne to come down, and she actually spent 5 hours with me running through different colours in front of my eyes from different lenses to work out which colours worked for me best. Which colours in the white light spectrum affected my sight. So it's a form of dyslexia, and it's now backed by the Irlen Dyslexic Association of Australia. I've been wearing these lenses for 30 years in Australia. Unfortunately, they're not on a lot of the healthcare systems or schedules at the moment. But for me, they worked, and I went from being a flunking student to essentially an A grade student overnight. I went on to study at university, and I now have a swag of certifications, qualifications, including a GAICD with the Australian Institute of Company Directors.
Wow. And I know that this is going to cause some controversy around glasses. when so when we talk about Irwin syndrome, we usually separate the two out between dyslexia and Irwin syndrome. What are your thoughts around that? As two different conditions.
Yeah, look, I don't particularly take a view on it, Shay. My view is that these glasses have significantly assisted me. There are a number of things that I've built into my work life and into my life to ensure that I overcome some of the challenges, and I'll talk to those shortly, such as environmental factors, such as process factors, such as procedural factors. But I really don't buy into those discussions or arguments for myself, simply because I know that these work for me.
Yeah, and it's really interesting you say that because when we first started doing this work, we weren't really hearing a lot, and we still don't hear a lot of adult voices in Australia. And so there's a lot of pushback on the different things that do help adults. And for some adults, it is changing the background colors, or it is wearing glasses, or it is doing a variety of things that might not, you might not see in mainstream schools, or that have a certain evidence base behind it. And I think as we progress into adulthood, it's what works best for us, whether there's evidence base behind it or not. And so I think that's really important because otherwise we can get caught up in these technical conversations when really at the end of the day, we just want people to be able to succeed with whatever strategies work.
Agree.
If you haven't done so already, make sure you sign up to our mailing list so you can keep up to date with everything we are doing at Rethink Dyslexia. So head to rethinkdyslexia.com.au. And don't forget, if there's anything you heard today that was distressing, you can contact Lifeline on 13 11 14 or Beyond Blue on 1300 22 46 36. Thanks for listening, and bye for now.